Finally, we
ma'am.
have Dr. Mayukh here. Hi, good evening,
Hello.
Dr. Mayukh.
Hello, ma'am. Nice to meet you again,
Same
ma'am.
here. So
And hope
everyone
that this
have
session
that.
becomes great help to others.
Yes, absolutely. So I mean, just to tell everybody, we have with us Dr. Mayukh, who's got All India rank 29 in the last year NEET PG 23 exam, and I thought he would be the best person to guide us about, what should be the last day strategies, the exam hall strategy, what mistakes to avoid. So both of us together will try to give in all our inputs to help you guys, calm you down and answer all your queries that you have in these last days. So, Dr. Mayukh, starting with the first question that we have is wanted to know that how should the
Yes, ma'am.
students, like the NEET PG aspirants, they have their exam upcoming on this Sunday, how should they tackle the stress, the anxiety that they are facing? I'm pretty sure that you must have also gone through the same thing.
Yes, ma'am.
So, what was your strategy?
Ma'am, interesting fact is that before starting our session, 2 hours ago only the admit card is released, and many have maybe have got centers away from their city. Like I also got a center. I gave the option of Kolkata, but it was in Kolkata, but not actually in Kolkata. It was 26 kilometers away. So this also creates a bit of stress that how would we go? So this admit card release is going to cause an additional stress, I think. So in the last time, there is a lot of building up of stress, but we should focus. What stress is? It is the pressure by the resilience. So we should focus on developing the resilience. Like we should do any kind of yoga, exercise, whichever suits us. Means we have to find it out that which suits our body. We should give 1 hour time to that in middle of the day so that we can focus again on studies. And the stress, that is the anxiety that comes, it is the uh, means thought process of the future, tension of the future, that what is going to happen in my future. So I would suggest that we should focus on what is in the present. We should focus on the notes or the questions we are solving right now, and not think that what is going to happen, what is going to happen. Let's uh, be straightforward and focus on what we have till the very exam. What are the questions appearing, we should focus on that. आफ्टर द एग्जाम जितना स्ट्रेस लेना है, जितना टेंशन लेना है, उसके बाद लेना, कि कितना मार्क्स आएगा मेरा, कितना रैंक आएगा, उसके बाद लेना. अभी के लिए जस्ट फोकस ऑन व्हाट यू आर डूइंग.
Absolutely true. Even I agree to that. That in these last days, maintaining that calm, that positive attitude is going to be the game changer for the students who would be able to do that. And uske liye, right, I always keep telling students, thoda sa meditation, kuch breathing exercises, kuch na kuch karte rehna chahiye so that you calm down yourself. Tumhara respiratory rate, heart rate, thoda sa kam ho jaye so that you are able
Yes, ma'am.
to handle the stress in the exam hall as well.
Ma'am, I would ask like to ask you a question that you have been a top educator for years. So what do you think, what is the psychology of NEET PG exam? How is it? Means how is it different from FMGE or INICET? So how is it going to be?
Right. I mean, that's very kind of you to say, Mayukh, that I'm the top educator, but still
Yes, ma'am,
striving to be
obviously.
there, right? Every day is a new day. And but yes, talking about NEET PG exam per se, I mean, the major question that we see is the repeats. Are the repeats going to be there as compared to the other exams like INCT? Definitely, the repeats are there, though the questions are not repeated, but the topics are repeated. And what the students need to take care of is reading every question like it's a new question, not jumping to the answer thinking, oh, this was a previously asked question that I'd seen somewhere. And in that process, what happens is tend to make silly mistakes. कि ये question मैंने देखा, इसका answer ये था, तो इसका answer अभी भी ये होगा. But examiner, this is where the examiners generally tend to lay
Yes,
a
ma'am.
trap. कि वो question similar दिखता है, but वो question same होता नहीं है. One word here and there changes the answer. So very important to read every question very carefully without any bias and to read the except part, not part, true part, false part very carefully and not jumping to the answer without reading all the four options. है ना? ये बार बार हम देखोगे एग्जाम में कि पहला ऑप्शन सही लगता है बट हम पढ़ने में इतने वी आर सो मच हरी कि वी डोंट सी ऑल ऑफ द अबव एक ऑप्शन था एंड में. So the other two options also could have been correct. right? So these are the few things that should be taken care of. And NEET PG, I do believe that mastering the PYQs in this last days is very, very important, I believe, because a student cannot afford to make a mistake in a previously asked question or a previously asked topic. क्योंकि सब बच्चे सही करेंगे, right? They should not be focusing on the new drugs, the recent updates. वो एक आधा question यहाँ वहाँ होगा, but that is not going to be like the rank decider. Making a mistake in a commonly asked topic is going to be a blunder for sure, right? So practicing the previous year questions is going to be the game changer. So Flora is saying कि yes ma'am, sometimes answer same होता है and I do overthink कि same नहीं हो सकता.
Ma'am,
This is also another
ma'am,
difficulty that
I
the
would like to give one example from my NEET PG only. So a question that came that a child presented with 3 months of pain and the X-ray was given and there was a patellar fracture like thing was seen in the image in the NEET PG 2023 exam. And what is your diagnosis and what is the most probable management that you would do? So first option was tension band wearing in patellar fracture. So it has come 2 times in the once in the NEET PG, once in the NICT. So without thinking, I thought that there is no history of trauma. But let's think common. Let's think common. What has been asked. So I marked that. And means a surprising fact was that below the X-ray, it was written bipartite in a very small letters, and most of us skipped that. So we have to keep our eyes open, and like this game changer questions, like twisted questions can also come. But in other case, I thought one thing uncommon, like molluscum contagiosum lesions were given and lung involvement was told in an HIV positive patient. So most about 90% marked molluscum contagiosum. But when I saw that lung involvement is there, so I thought that maybe some other diseases could have molluscum contagiosum like lesions with lung involvement. I didn't have knowledge. So with lung, I marked histoplasmosis because it causes pneumonia also. So it turned out to be correct. So in the same paper, I played two contrasting sides. Like in one, I jumped to the diagnosis and one I thought. So what I did was reading by the cursor every line. I used to read by the cursor and every option also. So I would tell the students to do the same technique, that you don't miss out a single word. Even a single word is
that's
going to change
very
the
good
diagnosis.
tip that I learned that I've not learned from anybody else's. So everybody should pay attention to this. That जब आप question पढ़ो, you can actually make the use of that cursor, right, the mouse there, to make sure कि आप every word पढ़ रहे हो and you are not missing out on any word like except and false. That's very good. And another lesson that I learned from Mayukh here is you can make mistakes. Like he made a silly mistake. I would say image में देखा नहीं कि bipartite patellar लिखा हुआ है, but वो देखा नहीं, right? But still, you can get all India rank 29. So making mistakes is allowed. ऐसा नहीं है कि
Yes, ma'am.
to get top ranks आपको पूरे 200 questions के answers आने ही चाहिए.
I think 1 to 3 is the range of silly mistakes that won't affect the rank to too much. Means everyone tends to get this 1 to 3 silly mistakes. Means I didn't get any silly mistake by not reading the question, but at that time application sometimes it comes into play, that time that thought process doesn't come. So 1 to 3 I think is the normal range, but above that if it goes, then it's going to adversely affect the rank. And if it is in the cluttering zone, it is going to affect more
Yeah.
rather than the top region.
True, true, true. So, Mayukh, we would also like to know that how many questions did you attempt? How many did you get right so that you got a rank of 29?
Ma'am, I attempted 198 questions, so 178 were right, 20 were wrong. After coming home only, means after giving the exam, I knew that 600 would be at least correct. But after watching the review, I got that about six means 680 like that was coming 677 to be specific, 677, and 4 questions were in confusion, in dilemma, controversial questions. So among those 4, 3 came to be right, so from 677 to 692. And that time prep ladder was also showing rank, possible rank. So I gave 677 and it gave 52 to 62 rank would be there. So I thought that it would be the rank. And 15 marks increased, and so the rank also increased. So I think that the predictor was also very much good. Means if anyone gets 677, he or she is going to get 52 to 60 rank. So that helped me to calm the anxiety after the exam.
After the exam, I think एग्जाम के पहले एग्जाम के बाद ज्यादा टेंशन
हाँ
होता है कि अब मेरा रैंक क्या
हाँ
आएगा,
मैम,
स्कोर कितना
and
आएगा, कौन सी ब्रांच
it
एंड
is
कॉलेज.
justified to take that tension at that time. It is justified, but before the exam it is going to affect the preparation. We should focus on what we are doing at that present.
Yeah, true. But this time
Yes.
what has changed in the NEET PG exam is the new pattern. अभी exam पूरा 200 questions at a stretch नहीं होगा. It's going to be 40 questions, 5 blocks, 42 minutes each block. So it's basically one exam has 5 mini exams in it. So what do you think would have been your strategy if you would have given the exam and to get the same like top rank? आपका strategy क्या होता? Like how would you have approached that?
Yes, ma'am. I had talked to some of my friends who are in touch with me. So, what strategy they approach, and I had a session with Dr. Heath, AIR one in INICET. So he also told that take each set as a different exam. Like we give custom modules of 40 questions, so take it as a custom module. And if the set goes on, passes on, then forget about the set. Focus on the present set. And I would say to solve 10 questions. One of my friend only said this, to solve 10 questions in 8 minutes. And if there is any confusion, any lengthy stem question, and if you are feeling that it is creating anxiety, that what would be the answer, what would be the answer, just skip it. Just keep it or mark for review, because in NEET PG, mark for review is considered for evaluation. Just mark a option or maybe leave it empty and mark for review and shift to other questions. So like this 32 minutes you are having, you would solve all the 40 questions. Some will be left for review, and so in that 10 minutes you focus on those questions, one or two questions. After that, solving those questions, you review all the questions that you have not made any silly mistake or not, because reviewing the questions again is also important. So I would say to solve 10 questions in 8 minutes and keep the last 10 minutes for review.
I mean, that's a very good strategy. So the learning point is 8 minutes, 10 questions is what you have to target. So that in 32 minutes you are completing the 40 questions and you have 10 minutes remaining for review, which is there, right? And how many questions should be attempted is the next question. What I believe is there are 5 blocks which are there. So even if it is one question which is left unattempted, there are 5 questions which are left unattempted. So it's 195, right? The more aggressive, the better is what I personally believe, because you get one question right, it is +4. You get it wrong, it is -1. So if you get it right, you are getting +4, which is going to change your rank significantly, right? If at all you get right. So the questions where you know something about the topic, it's not a totally alien topic, you can rule out one option, two options, please try to attempt that. And at the same time, I would like to tell everybody is that it is not that you should know answers to all the questions, like we said, to get top ranks. Imagine that out of the 40 questions in each block, you are getting only 30 questions right. Still, that means that you are getting 150 questions right. That means you are definitely going to be in a good mid-range rank, right? So 10 questions answers, even if you are doubtful, it's absolutely fine. Then you take that 30 short questions to 35, 36, 38, depending on what is your target, right? It would range from everybody's target would be different. And it would also depend on the difficulty level of the paper. If the paper is having a lot of repeat topics, that means it's a comparatively easy paper. Everybody's going to attempt a lot of it. So make sure you attempt more. 195, 195 plus should be attempted. If you see that a lot of repeat topics, frequently asked topics are there, that means leave it one question per block, right? So make sure you are attempting every block, like Mayukh said, as a mini exam, focusing on the present, not worrying about the past block, not worrying about the future block. If every block like it's a new exam, and everybody please do not lose your hopes till the last block, because suppose if you are that few of those students who get the first block as the most difficult block, which does happen in the exam, please be prepared that you are not going to lose your calm there. Oh my God, I'm not able to answer the questions. Right? It might happen your first block is difficult, but second will be easier, third will be more easier. So please maintain your calm. Remember, you can win the match by hitting a six in the last ball. You have seen it so many times. So keep that hopes high till the last ball, which is there. Mayuk, you would like to add everything to the number of questions to be attempted?
Yes, ma'am. I would also suggest at least 38 and try to attempt 40. 38 to 40 should ideally be the range. And if it is a very tough dog, then 37, but not
Okay,
lesser
so
than that,
maximum
because at
three
least
questions.
193 to 195 should be attempted. And I saw one question that how to prevent overthinking while solving a question that is marked for review. So I would suggest to watch ma'am's video, because I also watched the cheat codes. Ma'am's video is there available on YouTube, and my one video is also available on YouTube, that how to rule out options. So you can watch those videos, that how to rule out options and what are the cheat codes are there, so that it would be a certain help. But for that also you need a bit of knowledge, and common sense should be present during the exam hall, because many uncommon questions are asked, like in our time the comet questions, which was collection of tap water for bacteriological index. So it could be solved by common sense. So you have to keep the calm during the exam, apply your common sense, apply your past knowledge, and try to apply it in the questions to rule out options. And if two options are ruled out, then you should always go for it, because 50% chances you are going to get correct. And if in those two options you can't make an educated guess, you don't have anything, any guess only, that this is correct or this is correct, I don't have any knowledge, then the first intuition that you are getting, then mark it only, because it is seen in research that 7 out of 10 times our first intuition is correct. So hoping that your luck is good during the exam, 70% chances that you are going to get it correct.
True that. I think that's a very common mistake made, that when the time is remaining for review, students tend to overthink and change the answers. Please
Yes,
don't do that, because the first instinct aa raha hai, trust that. Because that is the information that you have got from your subconscious mind, somewhere where the data was stored. It told you that when you saw the question. So please do not change the answers, right, by overthinking,
yes,
right?
ma'am. I made a similar mistake by overthinking, like Colombo plan was asked in Comet question. So it was totally a new question. No one had any idea. But to get a better rank, a top rank, I tried to attempt it. So at first I marked it as the Cobalt 60 units. I marked it for review, but during reviewing, I thought that in my college the PET scan is being set up. So it is the second medical college of West Bengal where PET scan is set up. Maybe this is a recent thing. Maybe due to that plan only in our college it is setting up. So this is overthinking. And I changed the answer and it came to be wrong. So this overthinking you should avoid. If you are having any first intuition, go for it, I would say. Most of the times it would be correct.
True that. I think that works for exams, and that also works for people. इसके साथ जाना चाहिए.
Yes,
Trust on the first instinct.
I would like to ask you a question. Being an educator for so many years and guiding about 1 lakh students, so what should they focus on? What materials should they focus on just before the exam in these few days?
So, I mean, if you ask me, if I would be in a student's place waiting for the exam, what I would have done is quickly going through all the PYQs once, just the question answer, like not overthinking on them. Just a question answer. ठीक है, this is like a flashcard. This is a one
Yes,
liner. This is the answer. This is a one liner. This is the answer. Because if we spend a lot of time now on that, we will never be able to complete the question. So basically, putting all those PYQs in the short-term memory, so that we remember part of it. And then when I'm solving those PYQs, the areas which I realize, oh, this is something that I'm not able to recall about this topic. When I would solve, like practice the PYQs, I would also think quickly about the topic. Okay, for example, there's a question on vasculitis. So I will think about all the important points, like which was C Anka, which had jaw claudication, which had arthralgia, GI pain, all of that. A quick flashback should go in front of your eyes in the mind of the entire topic. Anywhere you feel that this is topic जो मुझे याद नहीं आ रहा है, उसको लिख के रखो, and then we go back to our primary resource जहां से भी पढ़ा है और उसको revise कर लिया, so that we are thorough with the topic. Right. Apart from that, if somebody does not have the time, So I've also made available the PYT PDF, which is available on my app, MedSynapse as well, which gives a list of all the topics system-wise in every subject, what has been asked. So if anybody does not want to practice PYQs, I mean, even that's fine, but what they can do is only those topics they can review from the notes, whatever have been their primary notes, right? So the information has to go into the short-term memory to give that confidence कि मैंने एग्जाम के पहले सब सब्जेक्ट्स का थोड़ा थोड़ा रिवाइज कर लिया है. Impossible to do all the 19 subjects in detail. So please don't be under that misconception that 4 दिन में 19 subjects, my notes from first page to end page, I'll be able to revise. You will not be able to do that. Filter down, focus on the previous year questions and the related topics is what I would have done.
Yes, ma'am. Absolutely. And I think that also answers another question that popped up uh, previously, that how to memorize things. That you said that this is the active recall technique, that you see the topic and try to recollect. So I think this is the best method to memorize. By practicing active recall, we can also try the active recall by solving MCQs, but I think this is the best thing, and we get an idea of the whole topic itself. So I used to do a similar kind of thing because all the top platforms, they used to post a question on their social media handles, MCQ, daily MCQ. So I tried to write an answer with my all knowledge that regarding the topic, like all the top apps like the Prep Ladder or the Marrow, they provide a solution that which of answer is correct and a description of that option, like you said about vasculitis. So if the answer comes to be venous granulomatosis, so I would write that, and in vasculitis the classification and all the things I used to write, and I used to post it so that it would be helpful for others also. And if I do any mistake, anyone can comment on that. And by this I used to practice that what all things I had in mind, and it also helped in my final year exam, because in final year exam is a descriptive exam, so it also helped in developing the descriptive skills. And most of the questions that were asked in all the social media platforms, that is the Instagram or Facebook of Marrow or Prep Ladder, they are important questions only. So if we write down the answer, or if we try to recollect also that what all we know, and if we can't recollect, then just flip through the pages, then also it's going to be helpful, I think. And
Yes,
you
absolutely.
have all the means all the futuristic questions would be also answered because you are knowing the whole topic of the question. So like this, as ma'am said, that with the previous year question, you try to recollect all the thing, then the whole previous year topic would be clear.
Yeah, true that. True. Mayukh, I think we can take some of our viewers as well
Yes, ma'am.
on
Yes,
the
ma'am.
live this thing so that we can answer their queries. Maybe they have queries that we have not answered. So let's try to do that, and let's see whether they have any queries. Just give us a minute. And Mayukh, I would also like to know till the time a viewer joins.
Registration, one question came that should registration be done after internship? So I would say you to withhold, because if you are getting a rank in NEET PG and you are shifting to another state, so I would say you to withhold, or else you have to transfer it. So withhold for the NEET PG results. After that, you can do.
Okay.
No. Uh,
Yeah, I was asking a question that during the exam, did it happen anywhere? You started panicking, or you felt that, oh my God, I'm facing questions which I'm not able to answer. Did you face anything of that sort, or you were like, nahi, mujhe to sab aa raha hai and I'm going to get the top 50 then?
no, ma'am. Before the exam, by the ranks, I knew that if the worst also happens, excuse me, sorry for the disturbance. So if the worst also happens, I am going to land in top 300. That much confidence I had. But I used to think about the worst possible thing so that I don't make a mistake. Like I means the last day just before the exam, I went to the exam hall was 26 kilometers away. So I stayed in a guest house, and I have a problem of insomnia if I sleep in any other place. That is a conditional insomnia, and moreover the exam stress is also there. So means I won't suggest, but I took clonazepam because I had the habit. means if any kind of uh, problem happens. But after that also I had 2 hours of sleep. So for that also I had prepared that if less sleep happens, I am going to take a PCM tablet, caffeine tablet, and a pan 40 tablet to counteract the headache and acidity. So, but in the exam, I was a bit calm. And in case anxiety happens, I would suggest to do the deep breathing exercise like inhale and exhale. So like this 3-second inhalation and 3-second exhalation literally calms your mind. I would ask the viewers, if you are viewing this, you try inhale, exhale. Like this, you try for 10 to 15 seconds. You are going to see that your stress or anxiety is going down. And as I said, in one question, if you have in stress or anxiety in one particular question, then shift the focus. All Not all the questions are going to be that much difficult. 70 to 80 questions in my year, it came to be from the previous year, directly from the previous year or previous year related, very much related, not the topics, very much related to the previous year. So I would suggest you to skip to the next question and then focus on that question. Don't be focused on the past that this question I couldn't get. During marking of the review in the last 10 minutes, you focus on that. And in case you are having stress due to time, you are getting short of time, try to do this deep breathing exercise. This really helps and it has research articles also.
Thank you so much for that insight, Mayukh. And also, I mean, we have few queries. Let us answer that. How is FMG different from NEET? I would definitely like to tell all the students that for your NEET PG, please practice the FMG PYQs. If you have not done yet, still like, but quickly just go through the question answer. Like I said, even if you're not solving them actively, just to know the points, just to know the points that have been tested in the previous FMG, because especially in the recent years, I've seen that there's a lot of overlap in the topics and the questions that are asked in FMG and NEET PG. Like for example, the paranasal sinus X-ray views has been asked in both the exams, right? The putty kidney is important in both the exams. So you would see good questions in FMG exam as well. So try to do that. How many years of FMG you should do? If possible, like minimum have 1 year. That means 2 papers so at least कर लो, so that you get an idea. अगर time मिलता है, you are able to do more, then go for 2 years. Otherwise, minimum 1 year. That is 2 papers is what you should do. Okay, so that is to be done. And another
GT,
question, because I see this is GT score, the replica of the final exam. Ash is asking. So, recent GT is happening on the various platforms, and students are getting disheartened by the score and the competition that is there. Everybody's facing, especially this year. So, what would you suggest on that? How should the students take their GT scores?
Ma'am, I would suggest that don't at all think about the GT score because many things changes. My GT scores were a bit reflective in the last GT. I got 72 and it came to be 29. But there are many other examples whose scores were not reflective and they improved a lot. Means there is one in top 10 rank also. He or she got 3000 in mock exam. So from that he or she landed in top 10. So that example is also there. So if you strive that much and if you give the best shot during your exam, so massive changes can happen. So and if you are in the cluttering zone where the more the cluttering of the rank happens, and if you can increase 10 corrects also means 50 marks, if you increase, then your rank would certainly jump up to a higher extent. Like I used to give the example that if you are scoring 550, then your rank in previous year NEET PG it was about 8500. So you are not going to get all the top branches. But if you make more 50 corrects during the exam by ruling out options or by applying the common sense and studying these days hard, then you can get 600 marks, and in 600 marks you are getting a top 2400 rank. So all the streams, all the top stream, that is the radiology, dermatology and medicine, are open for you. And if you can increase to more 50, that is the 650 marks, then the top colleges are also open for you because you are landing up in a top 300 rank. So like this, if you tend to increase 10 corrects also, if you can make 10 corrects extra also, your rank would jump drastically. So I would say that don't take this GT scores in heart, and एनबीई वाले तो फोन करके पूछने नहीं वाले कि तुम्हारा जीटी में कितना आया था, तो वो मैटर ही नहीं करता है. जस्ट इन द एग्जाम what performance you are giving, that is going to reflect.
Very true. I mean, nobody's going to ask you before the entry in the exam hall कि Harrison पढ़ा था कि नहीं MBBS में, main notes पढ़े, main videos देखे कि rapid revision videos देखे. All that matters is those 3.5 hours of the exam. You know, कितने काम हो, how much common sense you are using, and how you are logically guessing the answer using integrating everything that you know. Direct answer नहीं पता होगा, but rule out करके definitely you can answer a lot more questions correctly. Just try to maintain the calm. Like I always say, in the exam, your attitude is going to be much, much more important than the aptitude. So expect like कि worst case scenario क्या हो सकता है, anticipate all of them कि मेरे एग्जाम हॉल में फैन नहीं चल रहा है, मेरा पीसी बंद हो गया है, आजू बाजू के सब लोग आंसर कर रहे हैं. Anticipate the worst and also anticipate if this thing happens, how would I respond, so that that does not come as a shocker to you. No matter what, you are maintaining your calm. Have the faith that जो भी होगा अच्छा होगा. अब तक everything has been so good, आगे भी अच्छा होगा. So destiny has written the best thing for me. Whatever is meant to be is going to happen at the right time, right? So if you have that faith, acceptance become very easy for whatever happens in your exam. And another thing, please do not worry कि exam में क्या होगा. कुछ नहीं होगा तो at least experience तो होगा, right? And that experience is going to help you learn a lot of things. So take every exam like an experience and not like a life and death situation. इसमें नहीं हुआ, so like this is going to be like the last thing, and my whole life depends on that. Absolutely not, right? When you were going to practice few years down the line, all this you will look back and you will laugh upon yourself कि फालतू में हम इस सब का टेंशन लेते थे. I mean, it's just one exam, one score, one rank. Everything is temporary. Nobody remembers that. Nor even your patients is going to ask you how much rank did you get, in what attempt did you clear the exam. कोई पूछने वाला नहीं है, right? So just take it, very, very light, like any other exam, like any other mock test and grand test that you give. Is what is the final advice that I would like to give to everybody here. Mayukh, over to you for the final words to the the upcoming EPG aspirants.
Yes, ma'am. I think we have missed one point, that exam day, what they should do. So exam day, I would like to mention that exam day, you should wake up early and reach the hall at least 1 hour before the set time, and carry the ID proof and your admit card, because in my INICET exam, one of the aspirant took his mother's voter card and he was not allowed in the exam hall. So to keep a check on all the important things very carefully, and wake up early, and have a light breakfast, not too much heavy, not too much light, a moderate kind of breakfast, so that you don't feel clumsy also, or you don't feel hungry also during the exam. So I would suggest that. And to maintain the calm, ma'am has said all the things, that this exam is not the final verdict, because there are many doctors, if you go and see that they may not have done the MD, they may have done diploma also, but they are in the top position. So the college, the rank, this all doesn't matter in the long run, but this time you should focus on this exam thoroughly, because this is going to choose your stream. The stream is very much important. The college, or which area or which state you are getting, that it may not be that much important, but the your stream you are getting or not, your dream stream you are getting or not, that is a bit important, because with that you have to spend the rest of your life practicing that only. Ma'am, I would like to say this only, and to maintain the calm during the exam. And if we could take anyone on call, to any
I think
lucky participant maybe.
majority of the viewers we have are very shy to join in here for the live this thing. I think they've put on all your queries. If anybody wants to join in, ask the queries in person, please do let us know in the chat and send us a request so that we can join you for answering your queries. And otherwise, I think uh, I don't see you. Please send a request so that we know that. And yeah, otherwise, we can call it off for this session, guys. And please don't get stressed. Please don't get anxious. You will get a feeling you are forgetting everything, but when you are there right in front of the computer screen, You will be able to retrieve all the information, have that faith,
Yes, ma'am.
trust your instinct, go with the first instinct. That is very, 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 very important. Right? So, thanking everyone for joining in here, and thank you so much,
Thank you, ma'am.
Mayukh, for
Thank you,
sharing all
ma'am,
the
for
valuable
calling me.
insights.
Ma'am,
I mean,
it's a
it
really
was our pleasure.
pleasure from a top faculty like you that I have able to shoot a live session. So I am really grateful,
We
ma'am. And
Our
hope that
pleasure
this
and honor.
session helps the student who have viewed and who are going to view.
Yes, thank you so much. And one last query, because the student seems to be very anxious about the FMG exam. Jaya Chandri and Kumar is asking, because we have protested for the FMG internship, will our paper be difficult and will it affect our scores and the passing rate? Absolutely no. Right? All these are self-imposed beliefs, limitations, and excuses that we have. Nothing like that is going to happen. Remember, whatever is going to happen, is going to happen for everybody. It's not going to happen specially for you. Ki the paper will be difficult for you. But first, it is not going to happen ki because of this reason your paper would be difficult. So please
Yes,
get
ma'am.
that out of your head. Don't let that affect your studies and preparation and the performance. Okay? Yes, absolutely lovely. You can take PCM. You can take Panta, Pantop, whatever you want to take that
Over
helps you.
the
Uh,
counter
you can take
medications
it.
you should take, you can take, but don't take clonazepam. I would suggest without means proper advice or without proper exposure, never take it. Over the counter medications you can take.
Yes, and absolutely everybody should carry these emergency medicines in your bag at least कि
Yes.
कभी जरूरत पड़ी तो हमारे बैग में तो है अगर एग्जाम के बीच
Headache
में भी
or
जरूरत
any
पड़ी
kind of allergy, you can be exposed to some kind of pollen right near the exam center. You can have allergy. So emergency medicine box you should have always. Like I carry till now every day emergency medicine box. So try to have an emergency medicine box.
Yes, I mean that's great. And last query after this asking feeling really restless while practicing PYQs, give me some tips. After saying breathing exercises, like Mayukh said, breathing deep breaths is what will help. Meditation and reinforcing that always that this is just another exam and nothing else. My life does not depend on this particular exam. NEET PG 24, right? So giving positive reinforcement, like they say, fake it till you make it. Fake it that you are calm. So till the time you make it. So please do that. And thank you so much, everyone. Again, if there are any other queries, please feel free to reach out to us. We shall be more than happy to help you in these last days for any query that you have. And again, thank you. Thank you so much, Dr. Mayukh.
Thank you, ma'am.
And I hope we'll keep doing such sessions to guide the future aspirants in the future as well.
Yes, ma'am. Thank you, ma'am.
Thank you. Thank you so much, everyone.
And good night to everyone.
Good
All the
night.
best.